Good evening, everyone. I'm delighted to welcome the first webinar hosted by the Special Interest Group in Eating Disorders. So this webinar will focus on the impact of COVID-19 on the eating disorder community. My name is Dervla Malone and I am the chair and founder of the PSI's Special Interest Group in Eating Disorders. It is an honour to have you all here tonight. I hope that you find this event informative and helpful for yourself and for those that you support both professionally and personally. This evening's event will include live presentations from a number of fantastic speakers. So we speakers from a clinical, research, support organisation and a lived experience perspective. Throughout, you can submit your questions and comments anonymously through the Q&A button on the bottom of the screen. At the end of the presentations, we will hold a live panel discussion with our contributors at 8 o'clock, and we will try to get to as many of your questions as we can. If you're tweeting about this event, please use the hashtag EDAW2021, so that's Eating Disorder Awareness Week 2021, and make sure that you tag us at PSIGED. If you require CPD points, I know we've received a lot of emails so far, so if you require a certificate or those CPD points, please send us an email at eatingdisorders@psychologicalsociety.ie after the event, and we will send on your certificate as soon as possible. We will have a couple of comfort breaks throughout the session, so you'll have time to stretch your legs, grab a cup of tea, and we will do our best to keep to this time, and hopefully it will all run as smoothly as possible. Can I also remind you to not share the link with anyone else? Our event is fully booked out, which is brilliant for our first event, and we're absolutely delighted. However, we are recording this event, so if you do miss it, not to worry, our recording will be made available following the event. So now, without further delay, I'm delighted to begin our webinar and welcome our first speaker, Dr. Deirdre Dunn. Dr. Dunn is a principal clinical psychologist working in the HSE's National Clinical Programme for Eating Disorders in the Adult Hub team based in St. Vincent's University Hospital. More than 20 years, Dr. Dunn has been involved in research and clinical practice in the area of eating disorders. And within her current role, she contributes locally and nationally to the rollout of the National Clinical Programme for Eating Disorders model of care. So without further ado, I'd like to welcome our first speaker, Dr. Deirdre Dunn.
Hi all, thanks very much for having me, Dervla, and for that lovely introduction. I might just mention, by the way, I'm not actually Dr. Deirdre Dunn. I'm so long qualified that I'm actually just Deirdre Dunn. But I'm very happy to have an honorary doctorate for it this evening. Thank you very much for having me to the PSI, and I'm really happy to come tonight and to talk with you about the kind of issues here around COVID and the impact on people with eating disorders. And I guess as well to be able to make a contribution to the week that's in it, so the Eating Disorders Awareness Week, and being able to mark that. So I'm going to share my screen, hopefully without too much hassle. And I will, oh, hold on a sec, we have to go back, it's never that easy. There we go, it's always a little trickier. Here we go. Okay, so I guess just to talk with you a little bit around what I'm hoping to speak to tonight. I guess I'm really aware that, for all of us, not just people with eating disorders, in this last year, COVID has been this massive game changer, and all our lives have been disrupted, and there's been massive upheaval. And, for the vast majority of us, it has been, really, really challenging in lots of different ways. But as much as it's been challenging, and we need to acknowledge that, I think I'm also very aware that COVID has provided us with opportunities as well, both in terms of growth for people themselves who are dealing with eating disorders, but also for us as services, as we tried to grapple with the changes that needed to happen in order for us to be able to remain linked in and working with people who are looking for our services. And I think it's important that we spend a little bit of time acknowledging the opportunities, primarily because the goodness that might come from this is the stuff we want to hold on to as we emerge from the pandemic, moving forward into whatever that new normal will be. I guess I'm conscious I work within an adult service. I'm one of the 3 community eating disorder teams that the National Clinical Programme has begun to run out or roll out throughout the country. And so I speak primarily tonight to the issues as they've impacted on people who are 18 and over. And I'm really aware that perhaps some of my colleagues, even from the child and adolescent eating disorder teams, are here tonight, and they will have a perspective and can maybe speak to, in the question and answers piece, to the experiences of younger folk who have been very significantly impacted by the pandemic. I guess in time, we're only going to know if what we're experiencing on the ground here in Ireland is in keeping with what's happening internationally. It may well be that that's true, and we're seeing emerging, data all the time. But I think it will be in the next months and years ahead that we'll fully know more about the impact of COVID on services and, as I say, on people with eating disorders. Okay, so just in terms of, I thought how I would pitch this is to talk to kind of the service response to COVID-19. And then, because that might be a little dry, I thought what might also be really helpful is to focus on really service users' experience of what it has been to access service during this time and to try to plot their course towards recovery. And I'll talk a little bit to that as we go on. The first thing I'm going to share is this infographic, for which I can take absolutely no credit whatsoever, but my colleagues in the National Clinical Programme for Eating Disorders, Michelle Clifford, our clinical lead, and Rona Jennings, amongst others, our programme manager, have put together this infographic to kind of mark the growth in eating disorder services over this past year. And I know all of this is being recorded, and you'll be able to access, I'm sure, these presentations after. So I'm not going to go through it exhaustively, but just to focus on, some of the key issues. I guess these numbers effectively reflect the activity levels that have been taking place for those 3 teams spread around the country. So there's our team here in Vincent's, which is the adult hub team. We have a child and adolescent eating disorder team based in Lindara over in Ballyfermot, Cherry Orchard. And then we have a 3rd team that came online in May 2019, which is the child and adolescent eating disorder service based in Cork. So when we look at all of this, I guess the bit that is really telling is the fact that we've had a 60% rise in referrals over this last year. Not all of this is accounted for by COVID, because obviously as a new team comes on site and services are provided, people are referred. But it is definitely an indication, I think, across particularly child and adolescent services, there's been a really significant uptake in the use of those services. And we expect, and for lots of reasons, I think, that are perhaps slightly, are varied. I suppose it's been less obvious within adult services to date, and in part that's because I think as well there's private services available for people presenting in adulthood for eating disorders in the way there isn't within a child and adolescent population. So what we're saying is that, most of the people who come, who are referred or come appropriately, people know who to come or who to send to our services. We had 228 referrals, 75% of those were appropriate, as I say. Anorexia Nervosa is the primary problem that we're seeing within these 3 teams. And then there's a significant drop into the next most common, which is people presenting with bulimia nervosa. And then, as you can see, down through ARFID and binge eating, with OSFED taking up about 10%. OSFED being the kind of what we used to call atypical anorexia nervosa or eating disorders. 75% of the people presenting to us are female, and 1 in 4 people coming to us are urgent and needed to be responded to in that way. And of those seen for assessment, 138 were offered treatment. and began, and with over 80% of them offered treatment within that kind of 4-week period. And I guess if you distill all of this down, effectively what this says is where there are services, people will come. And where there are quality services with good interventions, people get better. And we've seen that there are significant amounts of discharges are leaving well or on their way to wellness. And that's really important because we're looking to gain ever more data to support the rollout of this program. We know it's needed, and here's the evidence to suggest that what we're doing can make a difference. Okay, so moving on, I guess, eating disorders and COVID-19, has it been a perfect storm? Why all these increased referrals? Why so much more attention around eating disorders? And certainly in lots of levels, I think one of the things that has happened with COVID has been that all of our lives have been significantly interrupted, and our lives have become increasingly smaller. That's especially true and problematic, I think, for folk who are in that period of adolescence and into emerging adulthood, where their job is to separate and individuate, is to go out and create lives for themselves. And COVID has summarily put an end to that, or a pause on that, for a period of time. And I think we've seen lots of students, for example, who would attend our service, and both UCD and Trinity fall within our catchment area, you know, having to return home, having lived out in digs or living in student accommodation, and then trying to renegotiate their entry back into that home life situation again. And while sometimes that provides increasing support, it's also extremely challenging for people to have to do that. We all know what it's like to return home at Christmas time, even whatever our age is, and back into our family home if we're lucky enough to still have one, and then try to, we take the same seats around the table that we did when we were children. So to move forward and to individuate is very tricky when that's forced in on top of people. I think what we also know is, we've all lived within an environment of society in which there has been massive amounts of fear over this last year. And fear is contagious. And for many people, most people presenting with eating disorders, anxiety is a feature of how they live their life. They are often feel and are very fear driven, and tolerating uncertainty is a real challenge for them. It's the perfect space for an eating disorder to thrive. Eating disorders are full of rules and tell us exactly how it is we're supposed to be in the world. It takes away lots and lots of uncertainty, might provide in the longer term lots and lots and lots more uncertainty and anxiety. But in those mere moments, or those particular moments where we're flailing, there's a sense that often eating disorders can thrive with providing a bit of structure and certainty. Our eating disorder population is for sure not the folk that the public health messages of get out and be healthy and get walking, be full of exercise, engaged in lots of exercise. That's not the target audience for the public health message. But because our lives have got smaller, things like going for the daily walk and focusing on the foods that we eat has become more important to all of us, I suppose, in many ways. And that for folk who are struggling with an eating disorder, where often issues like exercise are already contaminated by their eating difficulties, it has become very difficult to not feel triggered by that. And definitely the reduced structure, the returning home, having often to maybe be at home with many more people than we would usually be around, trying to, the routine of perhaps being in school and having, clear breaks and clear lunchtimes, how all of that has changed for so many of us, with an increased access to food on demand, has not only, I think, caused and triggered the development of eating disorders for some people, but it's also changed the nature of the eating disorder that people experience. So that where you would have had folk, I think, certainly in our experience, who would have had much more of a restricted kind of picture, are now engaging perhaps at times in more uncontrolled behavior, where binging has come in and that scares people, and then purging comes into the picture. So it's changed, and I think COVID has really provided a very fertile ground for eating disorders to thrive. In terms of us, and I'll kind of speed through this one a little bit because I think it's interesting, but less interesting than the service user perspective. It's just to say, as a service, I suppose, or as services, one of the things we've noticed is just in line with the theme of those opportunities and challenges is we've had a reduction in services for sure, in the kind of resources available to us, in part because people have been redeployed, or there's just been, there's been a kind of a pause around recruitment. People have been absorbed in doing different activities. For us, in terms of working with people with eating disorders, is definitely because lives, as I keep saying, are become smaller. There's been a real limited opportunity for people to get out and challenge their eating disorder thinking, to try new behaviors and to work towards that more bigger, more satisfying life. In terms of people living at home, as I say, often, cohabiting in spaces where there's lots more people around, it's been really difficult for people to be able to negotiate telehealth, which has become our new norm, because, there's privacy and confidentiality concerns. How do I get space where I won't be overheard? How can I be safe to speak really about the issues that are going on for me? It's also been difficult, I think, for people, particularly those involved in doing trauma work. We haven't yet really figured out a way to engage with people helpfully and do process trauma work, which is a feature for some people with eating disorders who come to our service. And that's really been difficult for us to negotiate as yet. I guess what we know as well is that telehealth has provided, I think, in many ways, a safety net for lots and lots of people, and actually has not been the huge leap that we perhaps wondered it would be at the beginning, but it does provide kind of relational challenges. The level of connection that we can feel is probably slightly interrupted. And that for lots of the people who with eating disorders who kind of mask how they feel, who don't feel confident or safe enough to look for care or to show themselves as they truly are, that's been slightly facilitated at times, I think, by perhaps the telehealth option. That being said, opportunities have meant that we've stayed in connection with students in a way that we've not usually been able to do. So we can travel with people much easier now. If they're wherever they are, we can meet them there through telehealth, and that's been great. I guess it's also allowed us really to, with our blend, we've put in some new care pathways. So trying to address that issue of how do we still see people safely within this COVID environment, but also can we see them face to face on occasion where we need to, and do our physical monitoring, and also establish that really good connection, and then do a blend of that with telehealth. And that's, I think, been a really good experience for us all to see that there's different ways to do our jobs. So in terms of just talking to kind of the service user experience of what it's been like to be an inpatient during this time, I did speak to one or two of our inpatients who were kind enough to kind of share their experience with me. And again, I suppose for the people that I'm thinking of, they were already, at least one was already an inpatient prior to COVID hitting and coming into our lives. So that meant, I suppose, when we think about the challenges that were there for people who were in an inpatient setting, we've 3 inpatient beds in St. Vincent's Hospital. There was a really an impact of reduced services. When COVID hit, we lost our OT service within the hospital system, and our therapy ended. And that meant that for lots of people, or for our inpatients, it just meant their daily life became much grayer, much less involved. And there was a lot of loneliness in terms of long hours on inpatient wards, perhaps working on themselves, but also not having as much things to occupy themselves, and that being difficult. Visitors, obviously, that was compromised, and that was really felt particularly around the friendship issues. Clearly, it's difficult for families as well, and that lack of connection that might have occurred. But for our cohort of people, again, in emerging adulthood, the reality is that peer groups are hugely important. And when we're isolated from that, that's a problem. There was a sense that what's the point in challenging all of these things that scare me when ultimately I don't know what I'm returning to, and certainly what it looks like I'm returning to is just really not in keeping with my bigger life. So I can't really practice going to dinners with my friends or going for coffee shop meetings because I can't do any of those things. Also, that pervasive, just that those worries of kind of what is this all going to mean for me in terms of discharge planning, what's going to happen to me if there's lockdown on the unit. Many of those fears never came to pass. We negotiated lots of that. But nonetheless, that's being in the ether and was an additional demand, I think, on the inpatients. We spoke about, and actually it was interesting because I didn't know this until I spoke to about this last week, but that sense that, you know, staff, we all carry our own story. You know, staff and whatever discipline you come from, you're still just human people trying to manage a pandemic, and that has different implications for different people. And so certainly that sense of the transmission of folk working in healthcare, if their fears, particularly being referenced around times of, say, meal support, when really what we're looking for is kind of calm, contained, grounded, you know, support being available, when actually if a healthcare worker themselves was very stressed, that might actually have transmitted and made that experience at times more tricky. So too, the mask and relationship issue, one of my inpatients would have said to me, I would rather do telehealth with you, even though you're in the office near the ward, rather than sit with you wearing a mask, because not being able to read facial expressions meant that there was a real worry that there's a rupture or that somebody's offside with me, and the anxiety and distress that might cause. That being said, for one of our inpatients, she was very clear, and she'd had previous admissions. This one helped because there was no FOMO. There's no worry that everybody else was getting on with their life, because everyone's life had been interrupted. So there was no fear of missing out in the same way. And although loneliness was the downside, the opportunity for having less family and less friends in meant that there was an increased opportunity to process and less opportunities to be in flight from the issues that needed to be dealt with, and less need to be on, show that I'm doing okay. And for some people, it provided a kind of a valid excuse to take a break from perhaps family dynamics that were challenging, and allow them to work through some of those issues in ways that they might have struggled a little bit more to negotiate had COVID not provided that excuse. And then that sense that no matter what happened throughout COVID, there was always twice weekly psychotherapy that continued no matter what. And I think for the people that I interviewed, that was something that was really quite important. When we moved to the outpatient experience, again, it's a little bit different, but it's also challenges and opportunities. So being forced out of a routine was really scary. People that's, you know, involved in a particularly structured eating disorder way of living their lives, suddenly COVID changed that. So that was really difficult. And it was also really great, because it meant that it wasn't just a decision that was made by the person themselves, but actually society was shutting down, things were changing. Gyms in particular were named as closing as being so important. No more that pressure to sign on to whatever number of classes a week. For some people being able to say, you know, and for this person in particular, who was really brave, I think, during lockdown, it's the first lockdown, and kind of saying, I make a choice now to really move towards weight restoration, a challenge that was there for her. And saying that was actually really difficult, but easier to do because there was less scrutiny, the less acknowledgement, or less need to go meet friends, less opportunity to be so very visible. And that although it was really challenging and brought up loads of issues, that meant that she could just deal with that without all the additional bit in on it. Also, the opportunity to not have to do waiting rooms. And for those of us who work with people with eating disorders or have had eating disorders, we know the experience of what it is to sit in a waiting room with other people with eating disorders and the amount of comparison making that goes on. So with telehealth as an option, that meant that didn't have to happen. She could move away from that, and that was seen as a kind of something of a relief. And then telehealth being there all the time to provide ongoing support without interfering as much as all those logistical demands of getting in a car or negotiating public transport to get to appointments. And again, that same bit of the challenge of smaller life, really difficult to keep focused on recovery goals. People want colourful lives. It's very difficult to have a big colourful life when COVID is we're in the midst of COVID. And all that extra time, it's easy to get caught up into loops of ruminating and overthinking. And that sense that I'm different to the messages, to the people that they're trying to message here. I can't buy into the public health messages. I need to hold myself slightly separate. And then just, I suppose, final words coming from all the people that I interviewed. Everyone's carrying, and they're not on their own. I think lots of us probably attending here are also, and in the wider community are also, you know, have thoughts about this of what will happen as life after lockdown ends and we move back into whatever this new normal is. Where will my eating disorder be then? What of the gains I've made can I follow through, or what challenges will I face then? And then for that service user who I think was so very brave to kind of really work hard on her weight restoration, I asked her how did she feel now about herself and what she did back there in last March and April. And she said, I'm so grateful to my past self. It fixed what needed to be fixed, although it was very much the hardest thing I've ever done. So just final thoughts, and I hope that's in some way brings to life some of the issues that are there for us as service providers, but also for those who have been attending us. So thanks very much for listening, and I will happily pass you back now to Dervla. Okay, thanks.
Thanks so much for that talk, Dr. Dunn. I think you've really highlighted the fantastic work that the National Clinical Programme has done for eating disorders and how you've managed to change your services as well to accommodate for those during COVID. And I think the perspectives that you had there at the service users really made it come to life. I made it see how realistic it is for them, and yeah, the great work that you have been doing. So thank you so much for that. It was really interesting. So next we will move on to Dr. Neve Mcnamara. This is our next speaker before our first break. Dr. Mcnamara is an associate professor at Nottingham Trent University, where she leads group, identities and health research group. Her research explored ways in which group membership impacts individual health and well-being, and she has explored this in relation to eating disorders. Her work in eating disorders has been published in the British Journal of Social Psychology, the European Eating Disorders Review, and the Irish Journal of Psychological Medicine. So without further ado, I welcome Dr. Neve Mcnamara.
Thanks very much, Dervla, and thank you for the invitation to this event. It's really great to be speaking to you from Nottingham. I'm just going to share a screen. Like Deirdre, hopefully this will work. Just get rid of that. Okay. So again, thank you for that very kind introduction and the invitation. I'm going to speak a little bit, I suppose, picking up from what Deirdre was talking about in terms of the challenges faced by people with eating disorders, but also particularly looking at the groups that they belong to and that issue of loneliness and how those groups can potentially help with that at this time. So just to give you, I suppose, a little bit of background on the research group that we have here at Nottingham, we're very much interested in the social dimension of recovery. And we feel sometimes that aspect can be a little bit underdeveloped or under-researched when compared with the particular biological aspects of eating disorders or the more personal psychological aspects. And the work that we've done in the group focuses on two key themes. So looking at how you create positive, supportive networks, but also how those same groups that we belong to can sometimes impact and hinder recovery through maybe misunderstandings, misperceptions, and stigmatization of people with eating disorders and of the illness itself. And the work that we've done in that area has contributed to the development of the model of care in the new National Clinical Programme, particularly around that need to recognise stigma, how it can act as a barrier, and to educate the public and professionals around that. And also some work that I've done with one of our other speakers this evening, Harry Parsons from Bodywise, looking at the importance of peer support alongside other therapeutic measures and interventions. So I'm going to mostly focus on that idea of groups and identity for this talk. So just to give a little bit of a background, I suppose, on what we mean when we talk about social groups and how they're important and relevant to people with eating disorders. So this is taken from an area of social psychology that's often called the social cure. It's quite a new approach to understanding health. And it talks about the way that we can see ourselves as unique individuals, but also as members of particular groups. So for example, you can see yourself as a woman or as Irish. And that will depend on the context you're in. Certainly for myself, I've never felt more Irish than when we moved to England. Because it's very much salient or obvious to you all the time that you're not amongst your own. The importance of groups to our lives is that they can provide that sense of connection to others. They can give us meaning, sense of purpose. They also importantly give us social support in times of stress, and that's going to be important for thinking through how they impact on people during COVID. But they also tell us or can influence us in terms of how we act and how we, what we believe in relation to our health. So all of those resources, psychological resources together, can provide individual and collective resilience and enhance our physical and mental health. The more groups that we belong to, the greater the benefits that we can draw from that. So those benefits are enhanced and they're accumulated through membership of multiple groups. However, an important thing to note is that we only unlock these benefits to the extent that we identify with the group. So if someone places us in a group or categorizes us as a particular type of person, it won't really impact on us unless we self-categorize. So we have to feel that sense of connection to unlock those benefits. So that's a very brief overview of the sort of framework that we work towards in the group in Nottingham. So trying to think about how that impacts or how it might apply to people who are living with an eating disorder or in recovery. And we're going to focus on kind of the main groups that often are very important to this population. And that can be peers, whether online or in person. But often we'll see in the psychological literature, certainly a lot of attention focused on online groups and potentially the dangers of them, but also the benefits. Sometimes it weighs a little bit more towards the negative. Another group, and we've spoken about this already, is family and friendship groups, but also healthcare teams and how they can form a group that the person can feel part of. So the research that we've done on groups looks at the importance of the norms. So what I just mentioned earlier, the norms are the beliefs the group hold, the values they hold, and the behaviors they engage in. And we've specifically looked at the norms that surround things like dieting behaviors and appearance-related concerns. And we found that you cannot automatically say a group is good or bad for you. You have to figure out what does that group stand for. And when we look at those three groups, so we focused on in our research family, friends, and two different types of online group. Recovery groups, but also so-called pro-eating disorder groups, who are said to promote the idea of engaging in disordered behaviors, although that can be contested. And we found that actually the impact on the person, the impact on their well-being and recovery depends on what values and beliefs and behaviors are endorsed by the group. And that's what we mean by injunctive norms. And some work that Harriet and I have done looked at that difference between the different types of online groups. And we looked at people's experience of the groups and what was happening in the groups. And we found that recovery groups tend to have more positive pro-recovery norms. And this more recent work then seemed to substantiate that. So what we found when we measured the norms and the attitudes endorsed by the groups as perceived by the person in recovery, we found that friendship and pro-ED groups or pro-eating disorder groups often had more harmful norms as distinct from family and recovery groups. So we have to be really careful when we think of whether a particular group has a negative or positive impact on the person's recovery. One of the things that has come through over and over through the different studies that we're doing is the importance of family as a recovery resource, particularly in terms of that idea of social recovery, where you're reconnecting back with wider society, where you're tackling loneliness and tackling isolation. What we found is that The degree to which you feel a sense of connection with family or identification with family predicts your well-being, so in terms of your satisfaction with life, and predicted people's perception that they were able to get back on track in terms of recovery, so normative eating. And that happened to the young adult samples, so people aged between 16 and 25. And one of the things that we're looking at the moment is thinking about how can we include families a bit more and appropriately in adult eating disorder treatment, because as we know, they've given quite a central role in the treatment of children and adolescents, but sometimes that can get a bit more complicated for various reasons once you enter into adult treatment. Why we're particularly interested in looking at family is because we're getting these emerging results around how they can help people tackle the social isolation and the loneliness that often comes with an eating disorder, or goes hand in hand. I think Deirdre is mentioning that in context of COVID, but it's something that actually was a concern for people prior to the pandemic. And I think one of the things that the pandemic has done has kind of given more attention to these kind of social aspects of eating disorders that we've been talking about for a number of years, but maybe don't get the same attention as other aspects that we mentioned earlier. So when we think about loneliness, there's surprisingly very little done in terms of the experience of loneliness and isolation in terms of research with people who are living with an eating disorder. Although we know from looking at online studies and talking to people who participate in peer support groups that feelings of loneliness and isolation are very common. And it's often one of the reasons why people join online support groups, because they feel, they do feel isolated, and they feel that there's a lack of understanding out there amongst their other groups, and they can get that appropriate support when they talk to their peers. But we do know that loneliness is especially problematic during the acute phase of an eating disorder, and often precedes the return to disordered behaviours in recovery. So it can pose a significant threat to recovery. So as I say, it's a really important issue that we need to understand, and we need to figure out how do we help people with those kind of social aspects of recovery. Now, we do know that people with eating disorders have smaller and poor quality social networks, and that's for a number of reasons. Oftentimes people do believe they're a burden to others, so might tend to withdraw because they don't want, or they feel they're making other people upset, and don't want to talk openly about what they're experiencing. Also, in terms of the psychological processes that sometimes accompany an eating disorder, people will tend to show a bias or place more attention towards threatening stimuli or have a negative interpretation of an ambiguous situation. And that all can lead to a social withdrawal on behalf of the person. Of course, it's not all on the person. We do know there's a lot of stigma that's out there related to people with eating disorders, and perception or an awareness of that stigma can actually act as a barrier to engaging with people as well. So it's not for just the person to try and figure out how to overcome that. It's for us as a society as well to think about how do we speak about and treat people who are living with this disorder. So what I suppose we wanted to do was think about, well, how can family potentially help with this issue around isolation and loneliness, particularly when we were seeing emerging results around the potential for family to act as a really important recovery resource when we were seeing and looking at the norm study. And we also thought during COVID, I mean, that obviously, as we know, is an extreme stressor. And we wanted to see, would the benefits we were starting to see from family identification still hold when everyone was in, I suppose, a time where the group itself was under pressure. So Deirdre has kind of already mentioned some of these issues, but once the pandemic really started to be viewed a lot more seriously and we started entering lockdown, we saw a number of opinion pieces and editorials from researchers and clinicians talking about the potential impact of COVID-19 on people with eating disorders and what they thought would be problems or issues for people. And as Deirdre was saying, it clearly was a time of uncertainty and stress. There was a lot of scarcity talk around what was being available. We could see in the media pictures of panic buying in supermarkets and empty shelves. Clearly there was exercise restrictions on how many times you could exercise, but also where you could exercise. There was access to health services more generally were restricted, or people were impeded from accessing their usual appointments. The social distancing measures linking to isolation and loneliness were particularly difficult, and people saw the potential for an increase in social isolation there amongst everyone, but particularly for people with poorer quality social networks, including people living with an eating disorder. There was the suggestion more time at home would cause additional strain and maybe exacerbate the disorder for people who were in recovery, maybe potentially relapsing, and linking that explicitly to feeling lonely and feeling at a loss for things to do and having a routine disrupted. What people were predicting was that there was going to be more reliance on negative coping strategies to deal with that uncertainty and deal with that anxiety. But what we started to see once people were doing some empirical work was that there were some positive impacts reported as well by people with eating disorders, but also their families and carers. And they talked about an increased connection with family and friends and being able to spend more time together as a family. So while there are obviously significant challenges and we have to be aware of those, we have to also look at, well, where are the green shoots of hope that we're seeing, and how can we build on those and encourage those in the future? So we sent out a survey, and I think this is where we can add to Deirdre's really excellent overview of what was happening in an Irish setting. This was an international survey. So we started the survey at the end of April and continued to the 3rd of June. And so that was last year, and that was the initial early stages of the pandemic. And in that survey, we measured a number of different things, like people's sense of connection to family, the number of groups that they were a member of, their sense of recovery identity, their online connections, health and well-being, their distress tolerance, and the impact of the COVID restrictions. So health and well-being were ED symptom severity and anxiety, because those were two things that people thought were going to be exacerbated during the pandemic. So from that survey, we had over 200 participants. Mostly, as with most research on eating disorders, these are majority female participants. And a huge age, a very vast age range, so from 18 right up to 77 years. But so all adult, because that was a condition of participation. But again, primarily around about 30 years of age, 28 years of age. Most were from the UK, the USA, and Ireland. But we did have quite a number of people from Australia, New Zealand, Canada, South Africa, other European countries. So we had a good overview of people who were living under reasonably similar restrictions at the time. Most live with their family. So again, showing the importance of being with that group. And we define family broadly as partner, parents, other family members. Most had received a diagnosis, and anorexia nervosa was the most commonly experienced diagnosis. Almost half were currently in treatment. Most hadn't contracted COVID-19 at the time. So when we asked them about their COVID-19 related concerns, again, we did find what the experts were predicting. So the vast majority of our participants were worried about restrictions being placed on where and how often they could exercise. They were worried about scarcity. That this was at a time when, and we've had in subsequent lockdowns, we haven't seen the panic buying as such, but this was in the middle of the first one where people were seeing empty shelves. They were worried about the stress that was associated with shopping, worried about accessing their meal plan items. Coping at home, again, was a problem. Slightly smaller, but still majority of participants were worried about spending more time with others at home. And that was whoever they lived with. It wasn't necessarily family. It could be flatmates. It could be people they didn't know very well that they had just moved in with. So a lot of stress there. Others were saying they had lost vital sources of support they'd had before. And then again, as expected, people were finding it difficult to access the usual level of service that they had before the pandemic. And we asked people who wanted to actually talk through or tell us a little bit about what kind of expand on those concerns. And we had people talking about worsening symptoms. So people saying that, so this participant here, I was nearly fully recovered, but there's been a massive deterioration. And we heard that from quite a few participants, that they have the worry of relapse and feeling that they had been on the road to recovery and this was setting them back. As Deirdre mentioned, the issue around counselling, online counselling, and worrying about privacy and how to do that. Coping at home. Again, this is going back to the idea of whether the group is harmful or not. It depends on the level of understanding. So where people had families or people who they lived with who understood their struggles and were able to support them, they were okay at home. The people who weren't were tend to be the ones who felt the people they lived with didn't understand what they were going through. And again, feeling worried about shopping, feeling it was stressful, and then feeling lonely and isolated. So a lot of concerns. So I suppose this is showing that the concerns that are being seen in Ireland were seen internationally, and they were very much what experts had predicted. So I won't go through all these numbers, but we were trying to explore then quantitatively, was family protective? So we had seen in other studies that family, the more you identified with family, the less lonely you feel. And we were seeing this again, even during COVID-19, even during the time of an extreme stressor. The more that sense of connection that was there, the less lonely, the less anxious, the less severe eating disorder symptoms were. So we wanted to figure out, well, okay, we're seeing that family identification is good for well-being in terms of reducing anxiety and reducing symptom severity. What might explain why that's happening? And what we found was this kind of graph here. So the more you identify with family, the less lonely you feel. The less lonely you felt, the less you were concerned about the eating disorder related impact of COVID, the less anxious you feel, but also the less severe symptoms were. So we were seeing that in our sample, so from across the world. So we were seeing that impact of family identification. Of course, this is early days and we still have to do a lot more work around this to confirm those results. But I suppose the implications, just to kind of tie everything together, the pandemic is extremely difficult for people with eating disorders. We've seen that in an Irish context, we're seeing it in an international context. What we saw in our study were the levels of loneliness, anxiety, and the symptom severity were extremely elevated relative to population norms. So this is a real thing for people, not just in terms of worsening symptoms, but also worsening anxiety and very, very high levels of loneliness. What we were seeing, though, was that family could actually act as a protective factor, so could potentially help people in this situation, which is, I suppose, one positive we can take from this. And what our analysis has done is help us to start to understand why this increased connection. So we heard at the beginning of the pandemic, people were suggesting there might be those positive aspects of being in contact. And what we were able to do was show why that might be positive. It does have implications for intervention development for a number of reasons. What we found was that family identification was lower than we would normally expect. So we've done this kind of work in other groups. So in terms of economic resilience, so financial resilience, in terms of just a general community samples. And what we're finding is for this particular population, identification is a little bit lower than we'd normally expect. But that just means there's potential for improvement. And if we can think about how to bring the family together as a group and build those bonds and focus on how do we get through this together, that sense of we-ness, particularly when we talk about treating adults. I think these findings provide that framework for understanding why even in adulthood, family is so important and that we have a need to consider ways of appropriately including families where we can. So that's it. Just wanted to say thank you to the collaborators. We have a lot in our group and a lot of people who took part in the research. Obviously, a real thank you to them, to our participants. And that's some contact information if anyone would like to get in contact afterwards. So thank you again for the invitation, and I look forward to any questions that you have. So I'll just send you back to Dervla now.
Thank you so much for that, Dr. McNamara. Really insightful research, and I think it shows the importance that social support has in the recovery process from an eating disorder, and how important those people are in their lives, whether it's their family, their friends, and then how COVID has impacted that. And we've limited social support at the moment, we've limited social contact. So I think it really shows how this has affected people who are experiencing an eating disorder. So thank you so much for that. So that brings us to our first break. During the break, you may wish to submit a question to our Q&A. If you have any questions for the two panelists we just have, or if you have any questions later on, just send them into the Q&A function at the bottom of the screen, and we'll go through them later. They're also anonymous as well, so there's no need to worry about being identified. Please join us back here in 5 minutes when we will hear the remaining presenters. So we'll see you back at 7:10. So grab a cup of tea, stretch your legs, whatever it may be, and we'll see you back in 5 minutes. Thank you.
Hello everyone, my name is Lee Gillick. I'm a member of the PSI's Special Interest Group on Eating Disorders. I'm very pleased to welcome you all back. Hopefully you all had time to grab yourselves a cup of tea, and I hope you're refreshed and settled in, because we've got a fantastic lineup for you in our final two speakers. Just to remind you again that if you do have any questions for our speakers, you can submit them. They're all anonymous through the Q&A function at the bottom of the screen, and we'll try to get to as many as possible at the end. So without further ado, I'm delighted to introduce our next contribution, which is from Harriet Parsons. Harriet Parsons is the Training and Development Manager at Bodywise. She's done fantastic work increasing understanding and support for the ED community. As Training and Development Manager at Bodywise, she also works to provide the support component to the HSE's National Clinical Programme for Eating Disorders. In addition to this, Harriet gives frequent training and lectures on the subject of eating disorders. She is a fully accredited psychoanalytic psychotherapist holding an MSc in psychoanalytic psychotherapy from St. Vincent's Hospital's School of Psychotherapy, UCD. From Dublin Business School, she's a BA in psychology and an MA in addiction studies. Harriet's presentation will focus on the impact of COVID-19 on the ED community from a support organisation perspective. And I'm delighted now to hand you over to Harriet.
Thanks a million. I'm delighted to be able to speak with everyone tonight, and I found it so interesting so far to hear Deirdre speak and to hear Neve speak about that research into how family can be of benefit in terms of loneliness and helping the person with the eating disorder. I'm going to probably be talking a lot about what both speakers have already talked about this evening, and maybe give a wider perspective as well. So let me just share my screen here. Share screen, sorry, there. Can you see that there? Let me just go to slideshow. There we go. Okay. So what I'm going to be speaking about this evening is really the experience from the support organisation's perspective. So Bodywise is the National Eating Disorders Association, and I suppose in that way we have experience of people across all the age ranges, people who have never spoken about an eating disorder before, people who are in treatment and using our support services as a support, people who have never gone into treatment but are working away themselves, people who have finished treatment, and the whole way along as well, we're supporting their family and their friends. So our particular perspective, I suppose, is very broad. So I hope to give you a sense of what we've been hearing since last March. So it's about a year now, isn't it? So since then. So I suppose life before COVID, can we remember what that was like? Time is very strange at the moment, I feel. It feels like just yesterday, and it feels like such a long time ago as well. So before the pandemic, I suppose, what does our organisation do? In the main, we provide support services to people affected by eating disorders in Ireland. So that's people themselves who have an eating disorder, but it's also family and friends. And then a big chunk of our work is also in schools around education and prevention, and also working with professionals as well. And as you heard, we also do a large section of work collaborating with the National Clinical Programme for Eating Disorders. In terms of our support services, we provide a telephone helpline, and our organisation grew out of a support group. You know, in 1995, a group of parents came together and set up a support group, and it's out of that really that our organisation has grown. And up until the lockdown last March, that support group was still running in Dublin city centre. And that face-to-face group. So we have an email support service as well. Neve has mentioned that we have an online support group. So we have an online support group for adults, for people over 18, and for teens. And the research that Neve was referring to was really an exploration of how those groups benefit people with eating disorders and how groups can be of benefit in terms of recovery, and identifying yourself as someone who's trying to recover from an eating disorder rather than somebody who has an eating disorder. I think that that's one of the things that stays with me, Neve, from that research. As well as that, in terms of providing family support, obviously family can use the helpline and the email, but we developed in 2014 a family support program, which was really working with families for one evening a week for a 4-week time period, where we really bring families through, you know, how to understand an eating disorder and how to support their person with an eating disorder. We say their person because that person might be an adult, but it also might be a young child or a teenager. And that family support program, you know, before COVID, we would have done it in person. I would have been driving around the country, sitting with kind of 10 people in Tralee and sitting with 60 people in Vincent's, and would be having various different experiences of supporting those families. So that was what it was like really before COVID. So what happened then? The first COVID case was confirmed in the Republic of Ireland on February the 29th, 2020. The first fatality was March the 11th. And the Irish government announced a closure of schools, colleges, childcare, March the 12th. And I remember we were sent home from work, I think on March the 13th. So at that point, everything stopped. Everything came to a standstill. And we were all scrambling to know, what are we dealing with and what's going to happen now? And as Deirdre said, and I think it's interesting, Deirdre, that we both use the same terminology, a perfect storm gathered. And that perfect storm in the eating disorder world was that anxiety started to build. And there was suddenly this heightened sense of panic, confusion, not knowing. We found we were fearing food shortages. Everyone was buying toilet paper. There was a fear of confinement. So gyms shut, everything stopped. There was a fear of this, you know, not being able to leave your home, not being able to go far. Suddenly all of our routines were changed. You know, Deirdre spoke about the school routine changing, but all of our routines changed. We were suddenly spending an awful lot of time around people that we don't usually spend that amount of time with. My daughter is 17 and she said, I cannot believe I have spent my last year of being a child with only you guys here. And it is that feeling of just being around, you know, a certain group of people all the time. And yet some people were very alone. They didn't have people around them and they weren't meeting people because their normal routines were gone. Treatment services were disrupted at best, paused or cancelled at worst. And what we found on the services, listening to people's experiences was, again, it wasn't uniform throughout the country. Different places were responding in different ways. So at a family group, one person might say, well, we're doing telehealth, and somebody else might say, well, they've said they can't see us. And that caused huge anxiety and issues. And along with all of this stuff happening, there was this 24-hour news reel media coverage around every aspect. And what was particularly relevant for people with eating disorders was that a lot of it was around food, weight, exercise. These were the things, you know, these were the things. Everyone was going to have to start baking bread. Everyone was going to learn a language. Everyone was going to pick up a new musical instrument. Everyone was going to start exercising in a different way. And so there was this, what I imagine it as this huge should developed over our society. And the people with eating disorders felt the weight of that should. I should be doing this. I should be doing that. I should be doing whatever. And what we know about people with eating disorders is that, you know, they try really hard to be the best type of person, to do their best all the time. And so they are now trapped in this impossible position. And so what we've experienced since then has been the ripple effect of that. So in terms of our organization, what we did at that point was we went online. We were all working from home. We're still working from home. And the helpline, you know, stopped running for a few weeks until we figured out how we would, because the helpline was a service that was run from our office. So we had to figure out how to do that, how to transfer that. Our online groups stayed online, but demand started to grow. And you'll see at the end how the demand grew. We started to think that we needed to put 3 facilitators on the groups because there was so many people coming. And I'll talk in a minute about who was coming and what they were saying. Our email support service is always incredibly busy, and it remained busy and it increased. Significantly, we took the family program. I was in the middle of doing a family program in the Lucina Clinic in Rathgar when lockdown came. And I took that online, and then I took a break to figure out how I was going to do it. And so then I took the family program, the pillar program online. And as soon as we went online, there wasn't a barrier in terms of location. Anybody could come. Families didn't have to organize a babysitter who's going to pick up whoever from whatever. And so what we started to see with Pillar Online was that huge numbers were coming. And when I did it the last time, finishing there at the beginning of February, we had nearly 300 people come. So where I had been sitting in a room with 55 people in Vincent's, I now was sitting here with 300 people on a Zoom meeting. And not only that, in the first pillar that we did online, what really struck me was that sense of that multiple family members can join. I remember that there was one person being supported, and so her parents were there. Her siblings were there. 2 of her friends were there in their own houses, and both sets of grandparents were in different counties, were tuning in. So I was here and I was speaking to all of those people who were just supporting that one person. And that was an amazing thing about it. That was really gave me a kind of hope that actually something, you know, we can do this and something positive can come out of this. All of the training talks and all of our education work, that has all gone online as well. So what did we hear from people with an eating disorder? Deirdre has gone through a little bit what we heard, but I suppose what we heard on our services was this kind of really exacerbated eating disorder symptoms. So that would be things like the compulsion to restrict, the compulsion to exercise, the compulsion to binge and purge started to really overtake people, and they found it very difficult because they didn't have distractions. So they found it very, very difficult to to withstand it, to be able to not do it. Or they were in a situation where they're in a house with other people and they were finding it impossible to manage their anxiety because their normal routines were completely thrown out the window. What we started to hear on our services was people who were kind of at the tail end of their treatment or the tail end of their journey, were suddenly feeling really discombobulated and like, you know, fearing that they were going backwards into their eating disorder. So lapsing and relapsing. So the reactivation of symptoms that they would have had that maybe they had gotten out of. So everything about the pandemic challenged those aspects. There was huge anxiety and stress. I mean, we're all stressed and we're all anxious to a heightened degree anyway. So I'm sure everybody felt it, that, you know, if some little thing happened, you were reacting in a way that really was over the top, or really, you know, when you thought about it, it's because we're all feeling anxious and stressed. But that has really contributed to this idea of emotional eating. And so what we started to hear on services was people being concerned about other people whose eating started to become really, really disordered. Okay, we heard around people having a real problem around secrecy, keeping what they were doing secret in a house full of people, or, you know, that pressure of, are you okay? You're on your own, and I don't really want to tell anybody that I'm struggling. So hiding the eating disorder from others. A sense of real loss of control over meal times, because now everybody is at home eating together. And, you know, within the family, I suppose it's an interesting thing, Neve, maybe to think about as well, is that, yes, the family seemed to be helpful for the person who had the eating disorder, but I wonder what it was like for the family who were now living 24/7 with somebody with an eating disorder, with no kind of way of getting away, you know, no kind of normal de-stress situations for them. So what I'm hearing from families is that's been incredibly difficult. Things like the eating disorder voice, you know, became very strong. There was increased compensatory exercise, binge eating was exacerbated. Again, people find it incredibly difficult to manage the relationship with exercise. And that is because of that major should. You know, I should be exercising. You know, you hear about people doing marathons in their back garden and all of this. All of that to a person with an eating disorder's ear is like, you should be doing that. And it's very difficult for them to separate themselves out from those health messages, as Deirdre said, to make them realize those health messages are not for them. I've talked about the disruption to routine, that perceived control, more rumination about weight, and all the changes to the usual coping mechanisms. So all of that lack of routine and structure perpetuated and mitigated the disordered eating. And then we have all the video calls. So there was always then this, you know, awareness of being looked at and of seeing yourself, talking to yourself basically. And I'm sure everybody has that experience when you turn off a Zoom call and suddenly you're confronted with yourself. You know, it's for anybody, it's difficult. And for a person with an eating disorder, it can really be triggering. That also came with increased time online, increased food and exercise messaging in the public discourse, and that kind of social comparisons. But then I suppose with younger people who weren't going to school, they felt the relief. I don't have to do it. I don't have to go to school. I don't have to push myself to be with friends. And that was one of the pluses that people talked about. Okay. There was definitely a disparity in accessing eating disorder services. Again, services generally, even GPs, some GPs seeing people, some GPs not seeing people. So some people were, you know, reliant on remote support. Some people were not able to provide it. What I heard was people being discharged kind of early. So somebody might be inpatient and it becomes too difficult because that kind of staggered discharge couldn't happen, because if they were coming back in, they'd have to isolate. So, you know, the usual transitions fell away or became problematic. and that caused problems for people. Yeah, I think Deirdre has spoken about this as well, but what we would be hearing from child and adolescent mental health services as well is that, you know, they themselves were under pressure. Lots of people were deployed into different areas of health and taken away from services, and that is also disruptive and been very difficult for people with eating disorders and for their families. Okay, so particularly then for families and carers, there was huge fear about premature discharge from services or change in how treatment services were delivered. Families found themselves managing multiple needs for the person with the eating disorder. So managing the meal times, but also then maybe managing weight and weighing and managing moods and mood swings and the thoughts and all of that. So they found themselves really having to, that they were the ones who had to figure out how to do it all. And lots of times families felt very alone, very isolated as a carer, and feeling also that that carers didn't have their own supports, you know, they didn't have their own family and friends around them to be able to offload and talk to. So from families, really, I suppose the main thing would have been the difficulty in knowing what they're supposed to do. And I think that's why we saw so many people coming to the Pillar programme, is to try and figure out how do we provide this support. But also what we found was that because the services themselves were under so much pressure, that they started to use the supports as a way of supporting the people attending the service as well, so that they would have a readiness both to be able to engage in treatment, but also to be able to provide support in a helpful way at home. Sometimes families said that when their person went into hospital, that they felt it was actually quite a relief because they could have some time off, because when it's all happening within the family, it's very stressful for the family, and they've, you know, they're on it 24/7. They've no way of you know, they weren't going to school, they were at home all the time. So it was all very stressful and very tense. And that has a knock-on effect. And then the positives were that, you know, being at home with family meant that meal times could be structured better, that everybody was eating together. So lots of families reported that that was actually a benefit, not having the influence of friends, and just having them at home and being able to kind of go back to basics really was a really positive thing. So what we heard from services were that people were presenting far more ill since last March, and that every referral felt urgent. And that's what we were hearing also on Pillar. And then in terms of how the demand for service increased, we saw a 110% increase in people attending the online support group. We saw a 48% increase in the helpline. We saw an 18% increase in our email support and a 98% increase in people attending Pillar. And then in January this year, the helpline was up 37%, and that's despite the fact that the helpline is down 2 days, and the email support was up 119% in January 2021 compared to January 2020. And as Deirdre said, in terms of referrals, they're up 66% increase, and 1 in 4 is urgent. So the most common message, this is the last thing I'll say, that, you know, is trying to think, well, what is the one thing that I found myself saying since last March? It has been to say to people with eating disorders, stay in the present, don't think about the future, stick to your routine, and that if someone lapses, just draw a line under it, support the person and start again. Okay.
Thank you so much, Harriet, for that. That presentation was absolutely fascinating, and I think it really emphasises the need for this service. There's a comprehensive range of supports that you've highlighted there, and I think it's really interesting the way that you've adapted the service to reach people who need it. I suppose overlapping a little bit with Deirdre's presentation about the challenges and the opportunities. And what really struck me was when you talked about like the family all coming together from different counties in one place online. So that was really interesting. And I'm sure we'll be revisiting some of the issues that you've raised in our question and answer session later. So thank you so much. For our final presentation, we're going to welcome Jacqueline Campion. Jacqueline is a recovery life coach and nutritional advisor with a lived experience of an eating disorder or eating distress. Jacqueline developed an eating disorder at a young age, and she spent many years in the condition, but she's now recovered and she's free from ED, and she's passionate about helping others on their recovery journey. She's the creator of the podcast Calling It Out, where she shares her insights on ED, recovery, and living a free life. We're very fortunate to have her here this evening to share her wisdom with us from a lived experience perspective. So I'm very excited now to hand you over to Jacqueline.
Thank you so much, Lee. Now, bear with me. I think the share screen is, it's the new starting of an Insta Live. So hopefully this comes across as I want it to. I mean, it just feels perfect. So hopefully if this doesn't come across clear, I'll get a prompt from someone on the panel to let me know. So hopefully everybody can see that. So first of all, thank you so much, I suppose, especially to Dervla and the rest of the committee and the PSI Special Interest Group in Eating Disorders for inviting me to speak this evening. It is a pleasure and a privilege, and especially thank you to Deirdre, Neve and Harriet that were speaking before me. It's just, you know, it's great to, it's just really nice. It's a nice opportunity to actually connect and hear from other people that are actually, you know, working in the area. So I have 20 minutes and I suppose it's going to be just scratching the surface of kind of ED in my experience. But I suppose, first of all, what I would like to maybe have you come away with from what I want to share with you is hopefully even just a little bit of hope. As Lee had introduced me there, I am fully recovered from my own experience of eating distress, as I would refer to it. I found it quite helpful in my own recovery to refer to it as kind of eating distress as opposed to eating disorder. My self-esteem was fairly low at the time, so the disordered part kind of didn't really sit comfortably for me. So I found it quite empowering to kind of approach it that I was recovering from an eating distress. So I might just use that terminology while I'm speaking. So apologies if it's kind of being mixed up. I obviously I'm getting no feedback. It feels like I'm talking to my computer here. So if there is something that maybe I haven't explained or I've said in a way that I've maybe not come across clear, by all means, please ask any kind of questions and it'd be my pleasure to answer them at the end. So I am the host of the recovery podcast Calling Out, which is really just a free resource that is dedicated to teaching people and whoever wants to learn how to recover and free yourself from eating distress, because I am conscious that there are people listening to the talk this evening that they themselves have personal experiences. So if you are someone who is currently recovering from an eating distress, I suppose just really that reminder that the ED can be temporary and you can be fully recovered. So no matter what the challenge is, it does get easier. So I suppose just starting off a little bit of my own personal experience. So as Lee had mentioned there, my earliest memory would have been at quite a young age. I would have been, around kind of 5-6 years of age, where I would have had my earliest memory of feeling, there's no kind of lighter word to say it, but a genuine kind of disgust and discomfort within my body. Now, at the time, I suppose, now we are getting a lot more understanding of eating distress, but we're still trying to knock out that kind of old narrative of, you know, it's just people who want to lose weight and things like that. But at that age, there was definitely no conscious decision that I wanted to start a diet or lose weight or anything like that. Even before any of my memories of any of the behaviors around my body and nutrition, that first one would have been just that kind of discomfort in the body. So I never really remember feeling good enough. That's definitely just, I always kind of felt like a bit of a black sheep in any kind of situation that I found myself in, whether that would be within even my family. And it was so great to even hear that kind of come up as you know, Neve, Harriet and Deirdre were speaking about the importance of family, because I think from my personal experience with ED, even within that community, I definitely felt I found it challenging to believe that I belonged. So definitely yeah, just reiterating that reminder that I remember it being said to me that, like, we do want you part of this community, we do want you, we do value as part of that family, so or part of our family. So it's really great just to kind of even remind ourselves with personal experiences that, like, you know, we are cared for. And sometimes family, you know, we all have challenges, some of us can have challenging situations, so family doesn't always have to be blood either. And I think it was so beautifully spoken about. There was a real sense of kind of the importance of finding your tribe when Neve was talking about the groups. So yeah, I suppose, like, you wouldn't have maybe known from looking at me that there would have been a severe self-esteem issues unless you would have had a lot of understanding. I would have come across very confident, borderline class clown. I mean, it was just very much so, I suppose we described earlier on, the pressure to be on, and I often felt that kind of just wanted to, I read the mask terminology is often used when it comes to ED, and I would have really put a lot of effort into putting a front that everything was okay and I was fine. You know, effed up, insecure, neurotic and emotional, I found out that kind of stands for, but that would have been a massive part of my experience. I was definitely highly sensitive, something that throughout my experience with ED I would have definitely seen as a curse. Throughout the recovery process, I've seen now it's very much so, it's a gift when you learn to have those kind of boundaries and how to actually utilize it. So I would have been in denial about a lot of aspects around ED. For my personal experience, I would have had a strong value in intellect. So the idea of valuing size or having any fears of my body changing in any sort of way. As I went through all behaviors, I pretty much kind of, as we know, when you're experiencing ED, you tend to kind of be a perfectionist. So I ticked a lot of those diagnostic boxes in different forms of self-destructive behaviors. But the acceptance of valuing fear of change of my body was something that I denied for quite some time. The label of eating disorder and even eating distress was not something I was straight away willing to learn about. And I kind of only started the recovery process from a place of stubbornness to, like, okay, yeah, I'll give it a go, but I'll show you it's not going to work. Thankfully, I was actually wrong in that situation. So I found it very confusing at the time. I think with personal experiences, you know, there's a lot of thoughts, there's a lot of, you know, I mean, voices. I would have not been telling people that I heard voices, and I heard different kind of different styles of voices telling me what to do. That's not something I would have been very forthcoming with at the beginning. So I was very confused and quite overwhelmed. But there is hope. Okay, I just wanted to give you a little bit of an outline of my own personal experience. So things that I would have found challenging with my experience with eating distress and eating disorders was constantly being in my head. Absolutely high on my own supply of thoughts and thinking and over-analysing, compulsive comparing, constantly looking over my shoulder of what the person beside me was doing. I mean, this would have been from a very young age, you know, a lot of kind of the constant need to perform. I'd mentioned that earlier on, this kind of mass, this kind of confidence, this really wanting to keep people at arm's length. I would have much preferred if I came across cocky than anybody, maybe find out that there was a lot of self-rejection and a lot of discomfort going on internally. I think it's important as well to notice that I wouldn't, as I said, I wouldn't have looked like we often see when the media is covering eating distress and eating disorders. Unfortunately, it has often kind of gone into a tunnel visioned narrative, which I didn't fit into, I suppose. And that was another thing for me where I never really felt like I was sick enough, or I was never really bad enough, to a point where even during my recovery I was like, are you sure this is eating distress, like or an eating disorder? It must be something else. Now I know we're making great moves in that area and the narrative is changing, but if there is anybody that's not slotting into the kind of diagnostics that are often spoken about. There's a lot of kind of destructive behaviors. I don't want to go into naming too many of them here this evening, but just to even maybe bring awareness if you do think that like I'm not maybe sick enough, or it's just maybe something I can handle on my own. I found it very challenging just to kind of accept myself as I was. Hardship was a massive, massive value for me. The idea of being gentle with myself or being kind to myself, I really thought that was for the hippies, I'll be honest. I just thought that was kind of people who didn't take jobs seriously or projects seriously. So it took me quite some time to even get my head around this idea of being gentle or being kind. And that would actually lead to being something effective. So it's just, it's very much so like there was very like a bully in my head and there was a dictator in my head. It was like, it just completely rejected these ideas, that kind of Hitler in my head. So that was something I found challenging. And again, I mentioned earlier on, just that kind of claustrophobia in the body. It wasn't necessarily like, I wasn't always having that kind of language of maybe size or like fat phobias that we often kind of hear about. That wasn't in my language from an early age, but I do remember that sense of feeling claustrophobic. And just, I suppose that brought up a very overwhelming urge to practice harm on my body because I didn't know what was kind of going on. I found it quite confusing. So what I found helpful, I suppose, and I'm a little bit conscious of time because I actually don't know what time I need to kind of stop talking at, but I'm sure someone will give me a prompt. And if there's anything I'm not covering, please just send me in a question. What I found really helpful in recovery, and I think this can be done in a pandemic or no pandemic, the idea of separating, Jacqueline, from conditioned thoughts. So I would refer to kind of ED thoughts, like conditioned thoughts. And I'm just going to share a kind of diagram with you now, very simple diagram. It's no Picasso, but I suppose it's just something for my own personal recovery I found very simple. So you got two pictures there, and kind of the first picture is kind of almost illustrating the subconscious mind versus the conscious mind. And when I remember seeing this first picture, really just describing to me that you have these kind of red thoughts and you've got these green thoughts. And these red thoughts were, I remember being explained to me, these kind of conditioned thoughts, the thoughts of the bully, the thoughts of the dictator in my head. And I found that so, I suppose, liberating. First of all, a relief that I was not my thoughts, because yourself, if you're experiencing an eating distress, if we were our thoughts, sure, I would have been, I often say I'd be locked up years ago if I was my thoughts, but thankfully I wasn't. And I just remember seeing that's the conditioned mind, that red part, it's like your whole subconscious mind is just taken over. That's like 50-50, but completely taken over by this regime almost that wants to control you. It's like an abusive partner in your mind. And then I remember seeing this kind of other picture at the bottom there with those green thoughts, that they're those kind of freedom thoughts, those kind of empowering thoughts, those beliefs about yourself that you could have. And I remember thinking it's like a little emotional bank account, that it's like, okay, well, if I could rebalance that, because I would be quite a visual person, so sometimes some of the theories I found challenging, but when I saw that, I found it quite helpful. So really just separating condition and ED from Jacqueline was just such a relief for me, and really gave me this kind of, okay, I know what I'm kind of up against here. And I was quite competitive. I probably still am a bit, but not to the kind of self-destructive level that it was before. But that definitely worked for me. It was a little bit like a boxing ring, where the kind of condition had been training unopposed for years, and I didn't even realize it was possible to go in and give it a go. So huge thing I found helpful was realizing I wasn't alone in my journey, realizing that the thoughts that I had, that even some of the behaviors that I had, and this wasn't unusual, and I wasn't the first person to experience that. And I think that was so kind of spoken about so well, even with the speakers beforehand, and especially when Neve was speaking, that the power of connection, because I think the biggest part for me was that loneliness and that disconnection. So really connecting, I found so helpful. Hope, I think it's so important to kind of continue with the message of hope when we're speaking about ED. I'm not going to sugarcoat it. It is absolutely, a very, very challenging condition of the mind to be dealing with. But the freedom from it, I mean, there's, you can't kind of overdo it with hope, and how obviously action is required as well, but full freedom does exist. And I remember that being kind of said to me. And even there's days where I was really like, I just kind of want to, there was days where I kind of was sick of it and I wanted to kind of throw in the towel. But even just sometimes verbalizing the word hope was massive for me. Bringing awareness to my self-talk, I found it very actually emotional and quite challenging at certain parts of my journey when I realized how harsh I was with myself. So just bringing awareness to how I spoke to myself and making a conscious decision to actually shift that language, and just simple questions of like, what would I say to my best friend? That was just so powerful for me, because I didn't start recovering because I wanted to look after me. I personally kind of started recovering for other people at the time. That actually kind of, it didn't sit with me. I didn't care enough about myself to do it for me, but for the people that cared for me, that was my motivation at first. And it was very much so. I think with motivation, you can be inspired, you can be motivated by inspiration or desperation. So either going towards what you want or coming away from what you don't want. Mine was very much so desperation. I didn't always believe in full recovery while starting off the journey, but I knew I wanted to get the hell out of where I was at that time. So just changing the lingo and say, what should I do? I can't do this, I need to do this. So just really like, what could I do? What would I like to do? Even the idea of, I was so used to this dictator being in my head, I didn't even realize other people weren't always talking to themselves like that. I just thought that's how you were motivating yourself, just to kind of berate yourself. But yeah, just even the idea of questioning, like, what could I do? Even practicing saying my first name, I used to absolutely shiver when hearing my name being called on a roll in school. The idea of hearing my name, I felt so uncomfortable. It seemed to be something for me that really popped up the kind of condition's head. So just actually saying my own name and reclaiming that kind of power away from the condition, I found really, really helpful. So yeah, challenging the bully and the dictator in my head, just really, I mean, I used to set out to kind of like aggravate the condition, at least aggravate the bully, aggravate the dictator, the ED, whatever language you use on it. But even having that, okay, I'm gonna challenge the ED here at least 5 times today, and as I said, the kind of like I was motivated by that desperation and probably a little bit of a competitive edge in parts, but energy can't be destroyed or created. It can only be transformed into one form or the other. So might as well use some of, with condition, there are a lot of talents, I suppose, for people who are experiencing ED, but they get hijacked by fears and that kind of turns into a terrorism. So it's just reclaiming that power. I found this really helpful in my own journey, so I just wanted to share it. Again, I found the reminder just to kind of looking at my thoughts and not get too bogged down. I wanted to sometimes there was parts of my journey where I just wanted to stop the behaviors, and I was desperate to stop the behaviors. But even when it was described to me there that it's it's not what the Titanic saw that sunk the ship. It's everything else underneath it. So those kind of the behaviors that I was using to numb out the feelings was very much so coming from the thinking going on in my mind. So I found that quite helpful to realize that the behaviors are not the problem here. They're a solution to an underlying issue. So just visuals again for me, I found it quite helpful. Now I actually don't know what time I need to maybe stop talking, so someone might actually prompt me there. Oh, do I hear another microphone?
8 o'clock, Jacqueline.
Fabulous, thank you. Okay, gorgeous. So a couple of things, I suppose, in terms of, so that's kind of like what I found challenging, what I found helpful, just finding ways. And I think as well, like with eating distress, and as I said, people are experiencing eating distress or an eating disorder, like some of us are quite fortunate to kind of, we have passions. I think a lot of people with ED, they can be quite tuned into what's happening in the world. And sometimes I think we're almost looking for more systematic change than even, we're more passionate about that and our kind of ethics and our morals, especially these days. It's easier to kind of fight for a bigger cause than it is our own personal cause. So even things like that, I've even used in that kind of analogy that like, if we do, like I think now as well, there's so much change happening in the world and we are making kind of positive shifts. But even like if you are someone with personal experiences, just even being able to apply that kind of activism and motivation. And again, people with eating distress, we can be so caring for one another, but again, it can be hijacked by the fear that it can come into this kind of toxic people pleasing. But even just getting curious about like, you know, okay, what if I was to actually just even speak to myself like my own best friend today, you know, just seeing what comes up. I just wanted to pop in just a simple slide that could be, because I am aware that there could be some kind of parents and partners and carers, you know, and if you don't have a family member on board, I think that's so important that even to, sometimes you can just practice even self-parenting, or you're finding your tribe within other areas, that it doesn't always have to be, you know, blood, and it doesn't always have to be from the family support, because especially now through the pandemic, you know, not everybody has someone on board who wants to learn, but even with that, you know, we can be fully recovered. So just a couple of things, learning about eating distress, like learn about what it actually is and what it isn't. But I put into brackets there to kind of watch out for the overloading of information, because obviously as a carer, we can sometimes really want to almost do it for the person, and you know, we can have our own kind of fears. So just to watch out, I think we live in the information age, and when you are learning about something, you can get so bogged down by which book, which advice. So wherever you are going for your support, you know, really keeping it simple. When you find something and someone that is working and it's clicking with you and it's making sense, keep it simple and be careful of kind of going and getting too much information. Self-care. One thing I found really helpful from my own personal experience is when the people in my life were not role models for perfection, and they weren't role models for perfection, but role models for freedom and self-care. So really, I think it can be quite challenging. You know, I'm working in the area now, and I definitely see there are more burnt out carers and parents, and that's not an opportunity for guilt. And when you do have people with personal experiences, but it gives us, we don't have the same behaviors to numb out as a parent or as a carer or as a partner as you would your loved one. But one thing is if any guilt comes in for anybody with personal experiences listening to that, is that everybody benefits from recovery. You know, this is not just your self-learning. I've the privilege of seeing these kind of miracles happening every day, and that everybody benefits from the recovery. So it can be challenging, but beautiful things can be happening as a result of it. So just learn about recovery. You know, you don't have to be an expert in ED to be helpful, but just even learn about the recovery, looking and working on your own fears. I think it would be ideal if you were just bringing somebody to sessions and to groups and kind of say, okay, well, you know, that's, you know, that's over there, and you know, I can't relate to someone with ED, but we're all human beings. You know, when we're experiencing eating distress, we're still having human experiences. Okay, we've adapted kind of destructive behaviors for coping, and that's definitely not helpful. But just looking at our own fears as carers, you know, what am I afraid of? What's coming up for me? The importance as well, instead of kind of worrying, just actually getting things medically checked, and you know, speaking to whoever that you are attending, if you are attending somebody for treatment, you know, just definitely bringing that up and making sure that wherever you're looking for helps and support, that it is full recovery that is promoted, and just watching your lingo, you know, watching the language. You know, just the language that we're using. Do I myself use can't, have to, should, need to? There's no shame and guilt in that. We're all human. We're just even bringing awareness to that it's like learning the language of freedom, the condition where we're fluent in the self-destruction. So just a couple of things I wanted to share about what I've learned in recovery that support me now. I think some people be kind of like, you know, how are you getting on, you know, with this extra pressure? quite well, actually, thankfully, through the tools that I've learned. Now, I've never used so many recovery tools. I'll be honest. It's an absolute gift. But just that we're not our thoughts, you know, thoughts are like hailstones coming down in a window, and we're kind of like, you visualize yourself safe, just like the awareness and the observer. I found that so helpful, you know, that ED is definitely not a choice. Nobody asked for the ED. No one has the power to give an ED to somebody, but freedom is a choice. And that I am actually in the driver's seat, not my fears, the false evidence appearing real. Although sometimes it would have felt like before that they are actually running the show. Even simple reminders, reclaiming the power, connecting with the body, I suppose, using it as my teammate, it very much so gives me all the information of what I need, even though sometimes I would rather, you know, have more energy sometimes. But the body, I suppose, listening to it, when you're listening to the body, when the body calls and you pick up the phone, life is much easier and simpler as a result of it. And as Harriet, you know, beautifully described earlier on, you know, living in the present moment, and that takes practice. You know, I'm not saying that definitely took me time to practice, but it's definitely helping keeping me well these days. And yeah, that freedom is possible in the midst of chaos, even during a pandemic. We're making choices every day of, you know, how we can be gentler to ourselves and how we can be kinder to ourselves and our bodies, and that can be quite a liberating thing. So just a couple of different tips and tools. You know, the podcast is there that Lee had mentioned at the beginning, and that discovers more of those. I know I am aware that my time is definitely up here at the moment, but just a couple. One point to definitely make is that I don't know many people that experience an ED that didn't think that they were the special snowflake that wouldn't be able to recover. So if you do feel that like you are someone that will just have to live with it, you know, you don't have to accept that. And a powerful sentence I wanted to share that I found quite helpful on my own journey just there, and podcast is there, the Instagram has different tips, tools at Marino TC, and if any questions, please don't hesitate to ask. And yeah, I'll hand you back to Lee.
Thanks so much, Jacqueline. That was just wonderful and very, very inspiring. And just, I suppose, a few things that stood out what you were discussing. The first thing was like the stereotypes and the myth of what an ED might look like, how that can really like isolate a person who may already be feeling very isolated, experiencing an ED, from actually connecting with treatment or supports, and the need for a more inclusive perspective, that what you see on the surface is only really a small part of the picture. And I suppose you used the phrase, it's not what you saw that sunk the Titanic, it's what you didn't see. So to be curious about what we're not seeing. Also, I suppose separating the self from the condition, I find that really interesting, that idea of just kind of, I suppose, preserving the integrity of the self so that you can almost gain perspective on what is the condition. And I suppose there's a common theme coming up here throughout the night among all the speakers of family, groups, the importance of that support from others and that importance of connection. So I'm sure that there'll be these kind of themes will be coming up more in the Q&A as well. So thank you so much, Jacqueline. That was amazing. And I'm just pleased to let you guys know that Jacqueline and all of our speakers will be joining us shortly for a panel discussion where we'll try to address some of the questions that you've been sending in during the course of the evening. But before we get started on that, we're just going to have a 5-minute break to refresh. So we look forward to seeing you back here in 5.
So welcome back, everyone. I hope you had a nice quick break there. I know it's not hugely long, but at least you get to stretch your feet a little and grab a cup of tea. We've listened to some wonderful speakers tonight talking from a range of perspectives. In particular, I want to thank Jacqueline, who the bravery in sharing her story, I think, has been hugely helpful to a lot of people. And she speaks so honestly about her own experiences and things that work for her, and such nice anecdotes that she used to express what it's been like for her experiencing an eating disorder. So thank you so much to our speakers for contributing. So we're going to move on to our discussion. It's now time to delve deeper into some of the issues that were raised during the presentations, and I'm happy to say that we got a lot of questions in, and it's great to see that people are really enthusiastic about learning more and about understanding more about eating disorders. And so it's really great that we got a lot in. So I suppose one of our first questions, I'll just put this to all of our panelists. You might all have a different perspective on it, so it'd be great to hear your own opinions. So what do you think is the biggest barrier for people getting support with an eating disorder? And what can we do to overcome this barrier? Or what can services do, carers and people working within the service? That's just open to all our panel there.
Well, I might kick off there. I'm sure I won't be alone. I'm sure other people have their perspective on this too. I mean, I think that's a really big question, because what does support mean? And I think, you know, there's a range of how we think about this in general. I guess, you know, how, you know, what gets in the way of people getting the support that they need? Well, you know, that's a support, I suppose, ultimately speaks about the concept of relationship, and that relationship with services. You need services to be there. I think that's one of the struggles historically here in Ireland, has been that there haven't been you know, specific eating disorder services, hence the development of the model of care and the national clinical programs, with the aim of being able to, at least if people are interested in seeking care and support for themselves, that there should be a service there that's able to provide them with interventions and support that we know makes a difference. So that's one part, I suppose. I guess there's also the other bit around, well, if people are seeking support from families and friends, I think that's where the likes of Bodywise and, you know, support groups come in that form of being able to educate themselves around. I mean, Jacqueline spoke about that, the importance to know and understand what is it that their loved one or their person who's struggling is really experiencing. And I suppose one of the things that they, you know, the Maudsley and the Institute of Psychiatry over in the UK is one of the leading, I suppose, centres of excellence for eating disorders. And they would speak in terms of their family stuff, in terms of kind of what kind of, using animal metaphors, what kind of animal do we want to be when we're trying to support our people? And the idea that, you know, when our own fear system's up as carers and friends, you know, maybe we become a bit of a rhino sometimes, or maybe we become an ostrich, you know, we stick our head in the sand, or we do the kangaroo, we want to put our little roo back in the pouch and take care and make sure nothing bad happens. And yet the optimum is to be the St. Bernard, it's to be the dolphin gently nudging towards the shore. And of course that sounds awful simplistic, and it's never that simple. But those ideas, I think, are important. And then in terms of, you know, the reality is that people with eating disorders, and Jacqueline is talking about them, people who don't believe they matter terribly well and really struggle with a sense of self, don't lean forward to look for care, because often they don't feel like they're deserving of it. And that's where we as services and families and friends can lean out, and lean in to try to support, be the dolphin, try to make sure the services are there, try to be open and encouraging. But ultimately, it is a relationship. The person themselves has to come to a point where they wish to say, this is terrible enough that I want to try and do something that really scares me. And that scary bit might be to lean forward and look for help. So I'm sure that doesn't answer all of it, but there are kind of my initial thoughts, and I'm sure other people have other things to say about it.
Yeah, no, I think that's a really fantastic answer. I really like your idea there of the animals and what animal do we want to incorporate. It'd be interesting to get some other perspectives on that as well. And Jacqueline, yourself, like, what did you find to be the biggest barriers, or Harriet as well, working within Bodywise? You probably would have noticed quite a few.
Yeah, so I suppose when the question was put out, the first thing that came to mind is, you know, like what Deirdre was saying, it's a challenging one, because with people with personal experiences, you know, you're often not, it takes, you know, a lot of the time you're not kind of putting yourself forward. It's normally someone who's caring for you that tends to bring it up, and it can be brought up several times. You know, it's a very defensive, you know, kind of condition, and you know, as I said, it's like an abusive partner in the mind. So I was kind of sometimes even thinking about, even as a society, like even with talks like this evening, that even like everybody recognizing how much of an impact they can have, because it's even with the kind of nature of ED, I think it can be like, oh, you know, obviously, as I said, it's the nature of the condition. It's, you know, it's very serious. But I think the more we start to understand as a society of like what the nature of it is, and you've got someone that you care for in your workplace or, you know, in the staff room, and it's actually, the more we understand, the more we can approach it. And I think having that societal kind of understand that it can be temporary, that it doesn't have to be like, you know, I wouldn't be very forthcoming to be like, you know, I'm disordered or I've disordered eating. And it's even just kind of like, okay, that's a challenge. You know, and knowing what to kind of pick up on, you know, I suppose relationships with exercise, in relationship, in the family, you know, with friends, and that gentle nudge that Deirdre was speaking about. The more we're understanding, the more we can approach it like that. So that, I mean, it's scratching the surface there, but that's just kind of something that came to mind for myself.
Yeah, no, I think that's a really helpful approach as well. And Harriet, I don't know if you've anything to add there as well in terms of body-wise and what you've noticed during COVID.
Not much, Dervla. I suppose I don't see there's been any one barrier. I think that at every point along the journey to getting into a treatment that works for you, there can be a barrier. So there can be a barrier in the person. They're ambivalent. Eating disorders are ambivalent. The person wants to get better and doesn't want to get better. When they go to the GP might not understand, might put them off. When they are referred into a service, the service might be slow or it might not suit and they might not click. You know, they might go privately and try lots of different things. They might not work. They might not feel that they can be helped. So there's every step of the journey, there's potential barriers. I think the one thing I would say is that, you know, the parents would often say, how can I get my person to acknowledge that they have a problem, and that they would see them as being unable to get them help until they acknowledge that they have a problem. And I think that can be a barrier, and it is important to think that the person might not be able to explicitly acknowledge that they have a problem, and that you can start nudging them or leaning in, or whatever way you want to say it, no matter what kind of acknowledgement you have, even if it's just like a moment in a day, and then the next day they're completely back into it. But at every level, I would see there being potential barriers.
Yeah. I think that's understandable as well. There's just a number of barriers at play, and it's also so individual. It's dependent on the person and the supports that they have within their life. So I suppose we'll move on to the next question there, Lisa, whenever you're ready.
Yeah, so actually the question relates to that previous question, and it's just, if someone is resistant themselves to receiving support, how do you deal with that? And is it different if it's a teenager or an adult?
Will I say something about that quickly? I think that you have to expect resistance, because what you're asking the person to do is give up the thing that makes them feel safe and secure. So none of us will want to do that. So if you expect resistance, it's easier for you to manage it. As a rule of thumb, it can be helpful not to just focus on what the person is doing, but focus on how they're feeling, because that helps to reduce the defense and reduce the resistance. And yes, it can be easier with a young person, you know, who's 12, 13. It can be easier to get them to go to treatment than it might be for a 19, 20-year-old to go into treatment. So I would see that as, you know, dealing with resistance. You have to think about tiny steps at a time, and you have to think about trying to sidestep the eating disorder. You're trying to sidestep it rather than come at it face on. That would be my thoughts.
What about you, Jacqueline? Do you have any personal experience that might shed some light on that?
Yeah, absolutely. I mean, I smile. I think that Harriet said it like perfectly there. Expect resistance. And I think that's, as a parent, as a carer, as personal experiences, you know, any sort of challenge like that. And I suppose how it was, I'm pretty much just kind of echoing what was just said there, but it's like, you know, it's like if you put your hand up and you go straight at, you know, the hand, you're going to be met with resistance. So, I mean, I kind of often use the terms that like ex-robbers make good detectives sometimes. So that, you know, it's maybe because I'm fluent in the language of it, it can sometimes be easier, but parents, the more you're getting on board, or partners or friends, and you're learning that language, you're going to learn how to go in the back door with it. And that's even with personal experiences as well. You're almost like you're thinking 2 steps ahead of the condition, and you can do that when you learn about the nature of the condition. So yeah, I would be quite similar.
Mm-hmm. Anyone else have anything else to add? No, all said. Okay, next question.
Perfect. So this one specifically for Dr. McNamara there. So in terms of research, can you talk about research that has been conducted on the impact of social media on an individual with an eating disorder, especially with the rise of what I eat in a day, overflow of nutrition, you've these exercise accounts, gym routines, if you could speak anything about that, and the use of social media, how that can impact someone who's experiencing an eating disorder.
So it's a very big area. There's a lot done on I suppose social media, but also online groups.
Sorry, Neve, just to jump in there, I think your mic might be a bit muffled.
Is that okay?
It's just a bit muffled. You can kind of make it out. Did you try?
Just I'll keep talking. I haven't done anything differently to when I was speaking before, so hoping that this will come through. There has been a lot done in terms of online connections, often around the dangers of them. What we can see is it's the content, the type of content that's being engaged with. So not all online content is necessarily harmful, but more towards that content that's around restrictions, it's around dieting. That's where the danger lies. If you're more towards content that's more recovery supportive, so I think things like Jacqueline was mentioning about that podcast, it's about the online around you is really important as in person. So it's about that content and that type.
Yeah, thanks, Neve, for that. It's really helpful. Lisa,
could I just say on that, just to let people know that on the Bodywise website, we have a new body image website, and there's loads of research reference there around social media, just to add that in as well.
Thanks so much, Harriet. That's really helpful.
Okay, so this next question is specifically for Jacqueline. So what is it about the word disorder that doesn't sit right with you?
What is it about? I suppose, as I was mentioning earlier on, at the time, my self-esteem I would have had a lot of shame and a lot of guilt. So for me, the word disorder, from my experience, I found it just created a much kind of lighter sense and a liberating sense that it was the distress that was eating me. The word kind of disorder, and I know kind of from, not everybody feels the same, but a lot of people, they find that kind of shift from disorder to distress to be a little bit more empowering. Because some people can kind of feel like, okay, what I'm doing is disordered. So there can be sometimes a sense of I am disordered. So I suppose just from personal experiences and from other people sharing experiences, it's not for everybody, but it's just something that I found myself. It's a distress that's eating me. It's like an emotional distress. I mean, ultimately, I'd be calling it a not good enough syndrome, you know. But yeah, I mean, it's not. Yeah, I suppose if that maybe answers it. I just found it much more kind of liberating, the distress part.
And I suppose you were just picking up on what you were saying in your presentation. You were saying it was a solution. So in a sense, you know, it was a solution to that distress. Absolutely. I was very unaware I was so body mind disconnected, you know. I mean, if I was doing now what I was doing then, I wouldn't last very long, you know. But I was so disconnected, I was so numb, that yeah, like that wasn't
that wasn't the problem, you know, that was just the inner turmoil being taken out on the body.
So the disorder part kind of more focuses on what you can see, I suppose.
Yeah, I do think when you're looking at eating distress or eating disorders, you can get so blindsided by the behaviors and the diagnostics and as I said, there's massive moves being made and there's huge shifts happening, but it's, you know, we still have a bit of time to go, you know, even as a society, just to how we can understand more so we can be supported, because I think most of us probably know somebody who's experiencing an eating distress or an eating disorder, you know, that can be the unfortunate reality of it. So yeah, that's just for me. I just found it more helpful.
Mm-hmm. Perfect. Thanks, Jacqueline.
Okay, so our next question is aimed more so Dr. Dunn and Harriet there. So are some service users finding the phone or being online more comfortable as a means of communication? And will this option continue after COVID? So I suppose, Deirdre, that's probably more applicable to you within the programme.
Sure. Yeah, I mean, I think that's right. I mean, I think there have been some people who have been, you know, found the transition to telehealth and video conferencing in particular, rather than telehealth via telephone, for example. I don't think that necessarily is what we're talking about. I think the transition into video conferencing telehealth has worked for some people and has definitely allowed people to access services in an easier way and on occasion. I mean, I think that's the bit that I was talking about at the beginning of my presentation, is that there have been opportunities here. You know, I work in the HSE and I have done for over 20 years. And like every other healthcare organization around the world, it's a big old dinosaur of an institution at times. And it's by its very nature, it moves slowly. And yet COVID has actually pushed us into a place where we're having and doing things differently, which certainly for lots of us, at the front line is really wonderful. And certainly our wish would be that this will continue as an option for people going forward. Certainly at the moment, our educational group that we would have run face-to-face, you know, we're getting the same kind of buy-in to it. People are attending. It's much easier for people to come. And I think probably going forward, we will for sure continue to run that and run telehealth options as and when that seems. Ultimately, what we want to do is we want to provide patient-centered care. We want to do what works best for the people coming to see us. And if that means it's telehealth for certain people, then that's what we need to be doing. So certainly, I think within the National Clinical Programs, we'd like to hold on to that freshness and willingness to kind of, and the system being able to kind of absorb that and manage that for sure is something we'd like to continue.
Yeah, it's all kind of about meeting people where they're at, I suppose, and adapting to the environment. And even an event like tonight, you know, pre-COVID, we wouldn't probably have as many people. People have to travel, they'll have to leave work early. So it's great in times like COVID that we can have people all around the world attend events from their own homes. So it does make it more accessible to everyone as well. Harry, do you have anything to add in terms of Bodywise there?
Well, Bodywise will definitely continue to do things online. I mean, we might go back to doing the family program in person, because it's not the same thing online. It's completely different. It's a completely different thing. You know, I don't get to know the people the way I would normally, but it's great to be able to allow that number of people have access to support. So I think there's a huge amount of support that you can do online. Personally, in private practice, I suppose I wouldn't take on anybody new online without seeing them first, like without meeting face to face first. So I think that is a challenge of online work, that it's fine once you have a relationship established, but it's very hard to establish it if you've never actually met the person in person. And so personally, you know, for that, you know, work, it wouldn't be as straightforward, but definitely for support, you can do huge amount of work online. And I mean, I started off on the Rape Crisis Centre helpline, so I would have always provided support on the phone. Anyway, I think it's great. I'm really comfortable with it, and people can get a huge amount out of it.
Yeah, I suppose it has its advantages and disadvantages. It's obviously difficult to build rapport over video calls like this, but then it's so accessible to everyone. So I suppose we'll move on to our final question there, Lisa, if you're ready.
Okay, so this is a question for Harriet and Deirdre. So this is, I've limited experience in dealing with eating disorders, and paediatric units are not well equipped to deal with these patients. What do you think is the most important thing we can do to help their recovery, as they're often with us for weeks, waiting a CAMHS bed?
Well, Harriet, do you want to go first?
I don't mind, Deirdre. I mean, we probably have the same things to say about it. So for people who are working in general hospitals, I think, you know, understanding the kind of nuances of working with people with eating disorders can go a huge, long way in terms of providing support. I never forget a mum telling me about a nurse who was coming in to sit with her daughter when she was eating, and she'd leave her and she'd be fine, and she'd come back and her daughter was throwing her plate against the wall. And she said it took her about 2 weeks to realize that it was because the nurse had praised her after she ate her meal. And it was just that nurse needed to know that you don't praise in that way. And so, like, a big part of the work that I would do with Bodywise is training for kind of allied health professionals. So people who aren't necessarily providing the treatment, but that supportive part. There's huge learning that you can have for that. And it really is about understanding the nuances of the eating disorder, how the person experiences the world, what the mindset is like. And then there are definitely, you know, hospital protocols that are specific to eating disorders, which, Deirdre, you know about.
Yeah, that's right. I mean, we have Marzipan as the management of really sick people with anorexia nervosa, and that Marzipan kind of protocol, which was developed in the UK, has been brought here into Ireland as well. And it's a really good way of assessing people's risk, physical risk, and kind of the level of intervention that they might need at a particular point in time. And I suppose as part of the development of eating disorder services here, there's a desire to have in all of the acute hospitals a Marzipan team of people where you have folk who are, working within the areas of eating disorders, but also working then with pediatricians, working with, general hospital consultants, so that there's an actual team, and that as people come into the service, waiting beds perhaps elsewhere, there is an understanding that they perhaps go to a ward where in that situation, some, nurses have been provided with the education and the support to, and have some experience of working with people over the longer time. So if you think about a big acute hospital at the moment, say in adult services, somebody comes in through an emergency department, they could go to, depending on the consultant on call, they could go to any ward in that hospital. And it's impossible within a big acute hospital to train all of the nurses all of the time to know, or the healthcare assistants be able to know how to intervene. So it's really about those kind of developments coming on board. And also, hopefully in time, and this would also be part of the clinical programs, is that these new teams, as we become more established and there's more of us, that we're actually there, maybe not on site to directly work with the people who are, or work with the patients that are there on the wards, but being able to actually provide supervision or consultation, so that there's not a sense, because I think that, the reality is that most people working in that environment are really trying to do their very best. They just don't necessarily quite know how to do that. And that's an awfully difficult situation for the person in the bed or for the family members watching it. But it's also extremely difficult for healthcare people who want to provide care. So if we can lean in and develop those services better, I think we'll be able to have a more holistic sense of everyone working as part of a wider team. And I think ultimately the person who's been admitted is going to do better as a consequence.
Can I just ask as well, is there any place, because this was just part of another question, that somebody can go who wants to independently educate themselves on how to, use that language that would support somebody, not trigger somebody, to educate themselves? Are there any courses or like how would somebody go about understanding how to support someone in that situation?
Well,
do you mean as a healthcare professional, or do you mean as, sorry? Oh, sorry, Harriet. I was just trying to clarify the question.
Yeah, I suppose as a healthcare professional, it came in specifically about a family member, but I think Harriet, that. But if somebody kind of independently wanted to educate themselves rather than waiting for a course.
There was a couple of questions there from nurses, and there is a higher diploma in mental health nursing that has a whole module on eating disorders in Trinity that you can do. But also just to say, like, that is, if you want to get in touch with me, like, that's something that we do. So now it's not treatment, obviously, it's the supportive part. But Deirdre, do you know any other?
I mean, I think it depends on the level to which people want to take their learning. So, I mean, obviously there's things down to, you know, there's various courses around the place, some of which I guess, you know, you need to be careful about what ones you kind of engage with. But there are lots of online courses that are available in terms of teaching people. But it's really, I guess I would join with Harriet around, you know, that idea that in lots of levels, Bodywise does a very good job around leaning in around that stuff. And then as the teams come on board, there's going to be more kind of available support. So yeah, don't know if that's helpful, but that would be my thought.
Absolutely perfect. Thank you so much.
I suppose as well, from a carer's perspective, Bodywise do have that pillar program if you want to inform yourself more on what kind of language and how to support someone within your family or a friend or someone you're in a relationship with. And Bodywise do have a lot of great support around that as well, if it's more in a personal perspective.
Could I quick? Oh, sorry, just quickly. Just when you're talking about groups that at the Marino Therapy Centre, we're holding groups every Tuesday and every Saturday, and Saturday specifically, anybody like a partner, carer, parent who wants to learn in terms of support in that kind of way, that's every Saturday from 10:30 until 12, and you don't have to be attending on a one-to-one basis to come along, and you can ask any questions.
And is that online, Jacqueline, or is
that's online? The groups at the moment are via Zoom on a Tuesday and Saturday.
Brilliant. Thanks so much for sharing that information as well. So I suppose that brings our Q&A to a close. We got a lot of great questions. It's just difficult to find time to go through them all. So hopefully maybe over the next few days we can answer them on Twitter, and we will have a recording of this event available so people can go back and watch it. So I just want to say sincerely thank all of our wonderful panel of contributors to this evening's event. It wouldn't be possible without you here, and we really appreciate you taking the time to speak to us this evening, and also to our audience who have taken time out of their own busy schedules to inform themselves around eating disorders. And it's really enlightening to see how many people are interested in learning and understanding more about eating disorders. And we will do our very best to release the recording of this event as soon as possible. I also want to remind you that we have another event tomorrow evening, and that's in collaboration with the Special Interest Group in Autism. So that will focus on autism and eating disorders across the lifespan. And also just remember to send us an email at eatingdisorders@psychologicalsociety.ie if you want a certificate for CPD points. And I suppose that's all for this evening. Thank you all for attending. I hope you have a lovely week, and I hope you found this informative and helpful, whether it's in your personal or professional lives. So thank you so much.